Well, it is just a pleasure to be here.
Yeah.
It really is our pleasure. Welcome to the Holistic Hit Show. My name is Zane.
My name is Imad.
And my name is Kasim.
We're the Holistic Kids here to educate us kids from the inside out. On this podcast, we have talked a lot about chronic disease, and all of our guests have talked about the importance of our lifestyle in how our brain and body work. But we all know that lifestyle changes are hard, especially when we are doing them all on our own.
That is why we have the perfect guest, perfect person here with us today. She is a solution that will save the planet.
Dr. Sandra Scheinbaum. Dr. Sandra Scheinbaum trains people to become functional medicine health coaches and helps practitioners and businesses hire them because she believes that health coaches are key to combating chronic disease and reducing healthcare costs. As founder and CEO of the Functional Medicine Coaching Academy, the FMCA, a collaboration with the Institute of Functional Medicine, Sandra is a leader in the field of health coaching education. An educator, clinical psychologist, author, and public speaker for over 40 years. She found FMCA at age 65 because rather than retiring, she's on a mission to grow the health coaching profession so that millions of people can get the support they need to get to that leads to a healthier life. She is the author of Your Health Coach. We'll see you now. Functional medicine coaching, how to be part of a movement that's transforming healthcare, stop panic attacks in 10 easy steps, and how to give clients the skills to stop panic attacks. And also get her new book, the Your Health Coach, which we'll see today. We'll talk about today.
Thank you for joining us today.
Well,
Yeah.
thank you, and thank you for that great introduction.
We would love to hear your story.
Yes.
Oh, well, thank you. Well, I started out many, many years ago. I was a school teacher. And I taught kids who were having some difficulties, perhaps learning how to read or not sitting still in the classroom. And I then would train teachers. I taught a lot of teachers who were in college studying to get their master's degrees to become teachers of kids who had some special challenges and different ways of learning. And from there, I went back to school again because I really love learning. And I got a PhD in psychology, and I helped many people, a lot of kids. I helped kids who were suffering, for example, they had bad headaches, sometimes bad enough that they couldn't even go to school. And I would teach them things like breathing techniques. And then I would talk to their parents about what things they were eating. And I also learned a lot about food, about nutrition, and about functional medicine, which means that you look at what is really going on under the hood. What is the root cause? Why are so many people getting sick? And it often, as you guys know, has to do with the kinds of foods we're eating and getting enough sleep and getting good movement through the day and enjoying your life, not getting upset about things. And so now I train people to become health coaches so that they can go out and they can help millions of people, moms, dads, families, kids, older people, to live healthier lives because we know the solution. We can help prevent these horrible diseses.
That is amazing.
Amazing. It really is amazing that you're doing this because not a lot of people know how to really, because you go to the doctor and he doesn't really tell you much besides, okay, here, take a maybe prescription drug. Now what that's going to do is, it's going to lead to more side effects. So it's really important that you're teaching people to help others to really start caring about themselves
Yeah, and it is hard to do, because and you said it so well. Yeah, you go to the doctor, and maybe they'll give you a pill, or they might say, "Yeah, you need to eat better." But how do you really do that? That can be really hard. And so when you have somebody who is a coach, and like if you play sports, you would have a coach. If you, let's say you want to play tennis, you might have a coach who is helping you become a good tennis player. Or you're playing soccer, you might have a coach that is going to coach your team. And a health coach does the same thing. They don't tell you exactly what to do, but they help you to feel like you are in charge, like you are the one. It's up to you to make good choices. And that could be really hard today. Like you might be at school, and other kids might be laughing at you if you are eating a lunch with certain foods that aren't ultra processed, and they might think, "Oh, what's wrong with you?" and pick on you for that. And so a health coach can help you to stay really strong and have the right answers, and to understand why it is so important for you, for example, to eat a certain type of foods.
What's wrong with the current medical system and the way that we care for patients?
Yeah. So there are a lot of really, really caring doctors and nurses, and they want to do a good job. They really want to help their patients. But there are a lot of people who are sick, and there might be if you go to the doctor, there might be a long wait, like a long line of people in the waiting room to see the doctor. And so then when you get in to see your doctor, maybe this is the first time that they're meeting you, because maybe that doctor's office doesn't have just like one doctor. It may have 20 or 30 who are working. And so each time you go to the doctor, you see a different person, and they don't know you. They don't really know your name. They don't know anything about your family. And also they are pressured by their bosses at the hospital to not spend a lot of time with you. And they have to make sure that everything entered into their electronic medical record is all correct. So they spend more time looking at their computer than talking to you, and so, or to your parents. And so you might leave that visit and you feel like, oh, they didn't really understand what was going on, and they didn't take the time to listen. And so that's been a real big problem. And it's really different. Like when I was your age, and that was many, many years ago in the 1950s, and I had a doctor, and I remember him well. It was Dr. Wolf, and I saw him for years and years. And he knew me. He saw a lot of my friends. And when you would make an appointment, it was really easy to do. You knew the nurse, and it was a different kind of atmosphere, where they didn't have the great things in modern medicine that we have today, which are really, really good. But they had something that is really important, and that is they really knew the people that they were taking care of, and you felt really comfortable. And they did something else that have wouldn't have seen, because they don't do it anymore. But there's some doctors, it was home visits where they had their big black doctor satchel, and if you were sick, they would come to your house and they would take care of you. And so it really was a different system that we have lost. And of course, there were things that they didn't know back then. And so today they have really much better life-saving techniques and technologies. But we've lost that human touch in medicine.
Yeah, you're right. Because a lot of I like how you talked about before and a long time ago. Because a lot of things really do change in like a couple decades. And a lot of the stuff, I mean, sure, yeah, it's changing for the better, but it's also downgrading. We should have people like who are caring for us actually care about us, and not
Yeah.
just let them fly.
That's so you're so right, to really know you. And so a lot of times, and it can be really good. Like, for example, if you get hurt and you think, oh, maybe did I break, did I break a toe, for example? Well, you can go to urgent care, and those are common, and you can get an X-ray, and they'll tell you if it's broken or not. And that's really good. But a lot of people don't have a doctor and they go to urgent care for that's their main medical care. And it's really it is the kind of care that's not personal. They don't really know you. It wasn't like when I had, Dr. Wolf. He knew everything about me. He knew my grades I was getting in school, for example, and really took the time in those visits. And he knew my parents. And so that is something that we have lost in these large, large medical systems. And so some people think artificial intelligence is the way to solve the issues with the medical system, and that can help. But we really need to have communication. So someone who really gets you, who looks you in the eye and talks to you, and you feel like really comfortable, like you can tell this person anything, and they're not going to judge you, and they're not going to get mad at you, but they're going to help you.
Yeah,
Yeah.
you're completely right.
So.
So how does one start seeing a health coach?
Yeah. So, well, there are a lot of health coaches that are available, and there are websites. So we have at Functional Medicine Coaching, we have a directory. And for example, let's say you wanted to see somebody who was in your area, in the Chicago area. So you can search by location, and there are people who've graduated as health coaches. So just like with medical doctors, you want to be really careful to make sure that somebody is actually a coach and has gone through the right training, because anybody can just say, I'm a health coach. And how do you show that? Well, you need to pass exams through this professional board. So you need to be what we call board certified. And those are some of the things you look for. So you ask, where did you go to school? And are you a board certified health coach? And also that coaches are not doctors. So doctors are the ones, if you go to the doctor and they're going to say, you have strep throat, or you have, unfortunately, a lot of kids, more and more kids are getting type 2 diabetes at a younger age. So they make that diagnosis. They say what's wrong with you, and they say how you, and they are treating it. Coaches are the ones who help you change when change is hard. And what that means is that if somebody wants to or thinks that you should change how you're eating and stop eating so much ultra-processed food, the coach is going to help you do that and do it in a way that you're going to be comfortable doing it. It's not going to be hard for you.
Yeah. So why do you think that people why do you think that, especially the bosses, why do you think that they want to quickly speed through people now?
Yeah, well, hospitals are a business and they have to make money. And they get paid when somebody goes into, let's say they have a visit with a doctor, and insurance, they have health insurance, and they will get paid, but sometimes they don't get paid a lot for that visit. And if a doctor, let's say, spent an hour with somebody, then maybe they wouldn't get paid what that value is. They would, and so the hospital would have a problem because they wouldn't make money. They have big buildings that they have to pay for. They have, it can be expensive. So they charge a lot. And the way the system works, the more people that they see, the more that they're going to get paid. And so it's not, and also there's a large wait. They don't want to have so many people filling up the waiting room. Years ago, I used to work with this doctor, and he was the best doctor. He treated patients who had cancer, and it was a small little office in the Chicago area in the suburbs. And but he took so much time. Sometimes if somebody was scheduled for a half-hour visit, the visit would run over literally by an hour, because he couldn't leave a person that was in need. And so he would sit with them and hold their hand and cry with them. And that meant a whole lot of people were in the waiting room waiting, but they understood that was okay, because they knew when it was their turn, they would get that kind of attention. But that was rare. And most of the time, it is because there are so many forms that doctors have to fill out, and they have to make sure that they're in compliance with a lot of the regulations. And so it takes time, and they have to chart everything, and they have to make sure they get all those details right. So they have a lot of stress. A lot of doctors get burned out from this, and they get really tired of this system.
Yeah, you are absolutely right. Like doctors usually they get paid to how much people they see and not how much people they cure. So like our dad has to see like 110 patients a week for him not to get in trouble with the hospital that he works with. He sometimes has 4 patients scheduled for the same time slot. So in 15 minutes, how much can you actually understand the patient?
Yeah, it's so hard. And so, like, for your dad, that's so stressful. And it's hard then to be at your best because you're stressed. You've got a lot of people waiting, and the hospital is forcing you to see more and more. And you've got so many forms and rules and regulations to follow. And for patients, sometimes what happens even before they get in to see a doctor, it's very frustrating because they can't get an appointment. So there are fewer and fewer doctors being trained like it to be primary care. So they're like the family doctors and the internists, and there are not a lot of them like there used to be because more of the doctors are choosing other areas that of specialty. And so if you are, let's say you move just to this area and you don't have a doctor, and you may call around and you may be told this practice is closed, this practice isn't taking new patients, or they're taking, we'll have an appointment for you in September, like 6 months from now. And that's really hard on people. And then when they finally do get that appointment, they may have such a long list of things they want to talk about. They have questions. They have so many things that they want to talk about with the doctor. And often doctors are told you can only talk about one thing today. Like, what is the purpose of this visit? We can only talk about one thing, like this symptom that you're having. Let's say you have a rash. We can only talk about your rash. We can't talk about your stomach issues or the fact that you're kind of depressed and anxious, or other things that might be going on with you. And so then people walk out of that visit feeling like, oh, I didn't even get to tell them the main thing that was bothering me. And that's a big problem.
Yeah, that
Yeah,
is.
it
It's
is.
actually pretty frustrating that, like, they expect you, like, doctors are supposed to be the ones that are really helping you and helping you cure and feel better. But if they don't even get the time to let you let you explain how they can help, how are doctors supposed to help us?
That's right. And so they get really frustrated because they went to medical school and they wanted to become doctors to be those helpers. They want to help people, and they want to do a good job and practice medicine in the right way, the way that they were trained. And now they're often feel stuck in this system, which is why a lot of doctors leave the system and they discover functional medicine and integrative medicine, and they go off on their own away from that big system. And many choose to have health coaches, because what happens is when a health coach is in the office, then they can start to be, let's say you're told you can't see the doctor for a year, but maybe, oh, the health coach is running a group and you can join this group. And they're not acting as a doctor, and they're the ones who are welcoming you to the practice, and you can start to talk about your story. Maybe there are others, maybe you have issues with blood sugar, for example, or pain, and you can join this group, or you see them one-to-one by yourself, and you can start to tell your story and just talking. And so what the main thing that health coaches is so good for is that they are the best at listening. They take the time. They might take over an hour to, if you need the time to sit, and they'll really listen to you, and they'll look you in the eye, and they will ask the kind of questions that like show that they're really interested in you and you telling your story to them. And then that alone can feel really good, where you walk out feeling like, oh yeah, and like they really understood me.
Yeah, because like doctors, all they do is just like cure it. And maybe sometimes, like you were saying, they don't even get the main problem. But like health coaches, they'll really listen to the whole thing. Like it's not really just like a time over. Once the time's done, you can get out. Like not it's the like not really for the money, and yeah, they're actually just here to help you. Like they
Yeah.
can as much as they need time.
Yeah, you feel that way, and you feel like the health coach is more like your pal. Like you can. They're not going to think something's wrong with you. They're not going to be quick to, and it's all confidential. Like let's say they're working with kids, they're not going to. You feel like you're really safe. You can tell them anything. They're not going to judge you or laugh at you or think there's something wrong with you. And they might. And let's say you're confused about certain things. Let's say you're confused about what to eat, or as we talked about before, maybe maybe kids are making fun of you at school because you're trying to eat in a different way. That happened to my daughters when they were little, and often during lunchtime they would like, ooh, like what are you eating? And it was really hard. And so having a coach can help you and help parents also, because sometimes there are issues in families where not everybody agrees about how to eat. And so coaches can be the ones like you feel like you have a support, you have a pal, you have an ally. And also, sometimes in medicine, there are things that are really complicated and you just don't understand some things, like maybe you got lab testing, blood testing, and you're confused about what things mean. And the health coach in the medical office can be the ones who really take the time to explain things. And you can ask all the questions, and they can report back to the doctor also.
Yeah,
So
that's why we need more health coaches, because more health coaches can really be more pals. And we need these pals. We need people to really get cured and healed, and maybe even learn what to do, and so they can use it when something else happens.
That's exactly right. So what happens is when you have this pal, this health coach that you can call them, you can text them, and all of it can be done virtually. So they work like over Zoom online, or you can call them on the phone. And what happens is you can ask any question or tell them anything. They will provide education to you. And also, they can be the ones who can help report things back to your doctor, or they can help you. The main thing is really they help you feel like it's you who are in control. You're the ones who it's all in. You are the boss of your health, and then you can do things that might help you to understand more. Like for a lot of adults that like are especially older people, and I'm 75, so I'm that old person. And but they can encourage people to think, like, wear activity trackers where they're counting their steps. They can encourage them to move more throughout the day, or be more aware of the importance of sleep. So those are things that health coaches work with a lot as well.
So, like, when you see a health coach, what should someone expect? What kind of things are health coaches helping their patients with?
Yeah. So you should expect somebody who is the best listener. And so they're going to look you in the eye and they're going to say, I wonder what makes you happy in your life. When you are there things that you love to do, that you are so involved in this that you just get lost in it, and you feel so happy? So those are some of the questions. And then they might ask, like, oh, what's a typical day for eating? Like, are there any foods you've been told are good for you to eat, but you just don't want them? They're really yucky to you. So they might ask those kinds of things. And then they might work on things like, are you happy? Are you really stressed? Like, do you have, when you are things in your life, like going to work and going to school, do you look forward, to those things? Or do they get you really tense and you feel like, oh, I'm just so stressed out? And so they can teach you, like I used to do years ago, can teach you breathing techniques, can teach you ways to change how you're thinking so that you can feel better and you don't have to be anxious and you don't have to be so stressed out. They can help you with things like you are the ones who decide what you want to work on. And so you might say, my let's say, my mom thinks I should be eating really healthy food, and there are things that I just don't like, or like we talked about, kids are making fun of me in school, and that's really upsetting. Or you might say, I get really upset that I see all my friends just making these bad choices, and I don't know what to do. So it's all up to you. That's what health coaching is. It's somebody who's not judging you, who's not treating a disorder, but who is telling you. And the best thing that coaches do is they help you to think what's strong with you. Because often when you go to a doctor or you go to people who have to go to a therapist, and it's all about, you think, what's wrong with me? There must be something really wrong with me because I need to take all these tests, and oh, this is really bad. But a health coach talks about what you're strong at. So maybe you're somebody who has a really good sense of humor and you make people laugh and you're funny. That's a strength. Or maybe you have a lot of bravery. And so we all have these strengths, and health coaches will help you to find those. There's actually tests that test your strengths. And you can say, well, you are somebody who you're very kind. You're a very kind person. You're kind to other kids in your class, for example. And so that question, what's strong with you, keeps coming back over and over again when you're in a conversation with a health coach. They'll remind you of that, help you practice those strengths, and help you see strengths in others.
We love this so much.
So much.
We know for us, when we talk to people about our lifestyle, it can be difficult for others because they don't know where to start. So we are so thankful for kids and adults to have a way to make these changes one step at a time, and have a pal that can walk with us every step of the way. It makes it less scary to make changes. Thank you for writing this book right here. Where can people get this book today?
Oh, thank you so much. Well, they can go to Amazon, and they can get it on Audible if they are listeners, or they can get the hard copy version and a paperback version as well. So thank you so much for showing the book. And this has been a labor of love to write this book. And because I kept thinking how people's lives would be different when they were younger, if they had access to a health coach.
Yeah, so we really do need more health coaches, and we really need more people who are willing to go to a health coach and really just become pals with them.
Yes. Yes. And the good news about health coaching is that anybody can become a health coach. You don't have to go to college. You don't have to go get an advanced degree. You can become a health coach. It's a certificate. And maybe from there, maybe you decide you want to go further in a career. But we get people who are just out of high school want to be coaches, and people who are my age and even older. We had a man who's 90 years old, and he went through our program with his granddaughter. And so people who are retired, they think that they can become health coaches, and it doesn't take long to train.
Dr. Sandra, we know you have been in this health journey for a long time. What is one thing kids can do today to help our health?
Yeah. So one of the best things that they can do is eat real food. So everything you eat, you say, did this grow? Where did this come from? Or was it made in a factory? And does it have, as you turn it over in the back, and if you can't pronounce those chemicals, then you shouldn't be eating it. So every time you want to eat something, think, wow, I want to eat things that were just from the farm, and in the grocery store, in the produce aisle, or things that your grandma and your great grandma would know was food. That are things that are not full of all the chemicals that we have and that are hurting us.
Thank you so much, Dr. Sandra. This was such a powerful episode.
So powerful.
So powerful.
Oh, thank you. Thank you, guys. It was so fun talking with you.
Our pleasure.
Yeah, it really is
Our
our pleasure.
Now to recap Dr. Sandra's key points.
Our lifestyles affect our health, but most people don't have doctors. They can go to urgent care. That's not personal at all. We need to have someone who doesn't judge you or doesn't get mad at you. They work with you one on one and help you make these changes right alongside you. The coaches can help you make changes that make it easy for you.
Make sure that you are seeing a board certified health coach. Coaches help you change when change is hard. We all need a health coach in our lives. They are the best at listening. That alone can make you feel good. The health coach is your power. That is why please go out and get Dr. Sandra's book today. This is a must-read book.
Must read.
Must-read book.
Must read.
Must-read. Same thing.
Now, and thank you everyone for tuning in. Until next time, I'm Zian Sorry.
I'm Imad.
And I'm Kasim.
Follow my family and I on social media, Holistic Mom D, and look out for our book, The Teen Health Revolution, releasing November of this year. Kids need to learn from other kids. Please download our podcast on iTunes and leave a review so other kids and families can benefit. We need to create a healthy future for all of us and the planet. Join us in a couple of minutes for the next episode of the Holistic Kid Show, where kids can empower kids. Thank you, everyone.
Thank you, everyone.